I'm really excited about this year's theme, Closing the Care Gap, and specifically because we have an opportunity as a global community to really change this narrative. And there's a couple of concrete steps that we could take. And I think the first thing to realize is that closing the care gap is not, sometimes people think that this is something that is, at a higher end level, at the policy level. And while it is, and while we acknowledge its presence, I think there's opportunities for all of us in whichever field we're in, whether we're in the cancer space, whether we're in civil society, it's for a way to really push for closing this care gap. And I think on a community level, there is a need to acknowledge the social determinants of health. And we always say where you live shouldn't determine if you live. And I think it's an important conversation to have. So really looking at what is the access to preventative care, what is the access to clean water, living, accommodation, because all of these translate into how your health outcomes will ultimately translate. I think one of the other things that we do need to look at, still going back to the policy hat, is how do we build patient-centered national cancer control plans that really have a grasp of the patient journey and try to look at it all the way from prevention all the way through to supportive and palliative care. For instance, many countries in sub-Saharan Africa have patients diagnosed with advanced cancers, but is centered around palliative care. However, the resources that are available to palliative care are not necessarily commensurate to what is available. And so we're looking at how do we then, within a community, develop and build a robust system of palliative and supportive care services that are able to support our patients all the way from, I think sometimes people always equate palliative to end of life, but we're really looking at palliative and supportive care, which should ideally begin for all patients from the time of diagnosis and walk them all the way through their cancer journey.